we're going to use our traditional approach, which is to review the Institute for Healthcare Improvement curriculum. And then we want to just talk a little bit about, some of the, continued nuances about vaccination rates. I know that we've had pretty much a plateau in the Dakotas, regarding vaccination rates, and doing better than some states, but not as good as others. I just wanted to point out that having been a retired Veterans Administration physician of 30 years, I was amazed to find that the VA now is requiring 100% of all staff to be vaccinated by end of September. So we're seeing more and more of these mandates, and it's just really fascinating that that they're holding up legally. Just as a reminder, there was, as of at least 2 weeks ago when I investigated this, there were 41 hospitals or healthcare systems that require vaccination of their employees. So there continues to be this wave of requirements, and I suspect that once the FDA fully approves the vaccine in September, there will be even a higher, push for mandatory vaccinations. Much like we require everybody to have the influenza vaccine, everybody's going to be required to have the COVID vaccine. So I think really, quite honestly, staff need to be prepared for this. I think we need to continue the conversation, but also setting up the expectations that come September and the fall, that there's going to be mandatory requirements. I'm also, and this is just speculation, but I think given that the VA has mandatory requirements, usually what the federal government does, at least in my experience, is that they go in waves of rollouts, and so the VA is the first mandate, and I'm quite certain, but again, it's speculative, that Medicare and Medicaid will say that if you submit bills to Medicare and Medicaid for reimbursement for your nursing home, you need to demonstrate 100% staff vaccination rates. So I think we really need to be prepared for that federal mandate that'll be coming, much like the Veterans Administration. So with that said, what I'd like to do is just segue into our video, and then I'm really hoping that we have a good conversation today. There are a lot of questions that we want to address about what people are finding in terms of persistent vaccine hesitancy. And it's interesting. Everybody says, the vaccines, everybody's been, who's going to get it is going to get it, and those who aren't. But yet, look at places like Louisiana, for example. There's now 111% increase in vaccination rates when people are suddenly realizing that 30, 40, and 50-year-olds are dying from COVID. So I think the more, it used to be that, this is an old man's disease, it's only 80-year-olds and they have a 600% higher chance of death. Yeah, and that's true. And everybody else kind of viewed it as a common cold in the younger age groups, but not so much anymore with Delta. And I think there's just evidence pouring out daily now about the lethality of the COVID infection. So, and then the other point for today is we want to continue with this month's theme of trying to improve staff morale, so as part of a project improvement. And so what we want to do is, and I'd like you to think about just reporting what you have done, in terms of improving staff morale, so we can review those interventions, and whether you've actually measured staff morale before and after those interventions, because I think what we're hearing is that a lot of people are doing some type of staff morale project, but they're not particularly measuring whether put a dent, either upwards or downwards. It's always an open-ended question. Is the project that you're implementing, does it improve things, or does it actually bring things for the worse? So that's why we want to have measurements for that. And also as a reminder, we wanted to have the project. We want to develop a menu of what people have done, and then we want to circulate that menu to all the participating facilities so that you can kind of have a menu of options for implementing a PIP around staff morale, and then again measuring that. And I know we have a couple facilities are currently in the root cause analysis process of assessing staff morale, to get their baseline at the current point. So good. So why don't we go ahead and then go into the next set here. Okay, so these are this first slide here. So infections happen in only a small portion of people who are fully vaccinated, even with the Delta variant. So that's been one of the talking points. And the other point is that the emerging evidence suggests that the fully vaccinated people who do become infected with the Delta variant can spread the virus to others. So the original virus, the spread was much more resistant, whereas with the Delta, it's 5 to 9 times more infective. So its infectivity rate, the epsilon, rho, or the rho factor that they talk about. So for the original COVID, it was 2 to 3 times. So 2 to 3 people get infected for every 1 person who's been infected. So the transmission. So 1 person infects 2. Currently, 1 person with Delta infects 5 people. So it's an enormous uptick in the infectivity rate. So that's part of the big issue and why we need to continue to wear masks and PPE during this next outbreak of Delta. And again, as a reminder, these are waves. These are mutated viruses. They're waves of those, and it's just like influenza. It's going to come in wave after wave, and we need to continually guard and do everything we can to reduce the spread of the virus. Okay, so the important point is wearing a mask in public areas because of the high transmission rate. And I think even with the vaccinated people, that in public areas that it's really important to continue those masks. And it's really interesting observation. So I was in Chicago recently, and I was at the Brookfield Zoo, and it's outdoors. We'd think that people wouldn't be wearing masks, but everybody was wearing masks. So the community itself, is responding to that and taking it seriously. By contrast, when I was in Montana, when I went into the local grocery store, which was a large, shopping center, I would say that maybe 1 out of 10 people were wearing masks. So again, it's a cultural thing that I'm not quite sure, what it demonstrates to not wear a mask indoors, other than to say that, we really don't care about spreading, that we're going to spread the virus or not. To me, I think it's really disingenuous, quite honestly, for people not to wear masks, given the fact that I don't know, maybe they don't care whether they get it or not. But more importantly, do they care whether anybody else gets it? And that's all what we talked about previously about the altruism and caring for others and caring for your community. Okay, so again, we can go to the next slide, please.
And basically, her reminders are pretty consistent. The slide that Dr. Jurevich just covered, as well as the need for continued testing, as well as kind of some of these other routine things, isolation. These are the latest guidelines regarding isolation, as well as some of those obvious following the rules and that sort of thing. Casey, if you want to go to the next slide. And then obviously those who are immunocompromised and everything, just kind of some of those basics again of current prevention measures, mask, separation, that sort of thing. And going back to the slide that Dr. Jurevich covered, some of those things as well for those in your household that are immunocompromised as well, and taking those proactive measures even if you're vaccinated. Next slide, please. And then I also talked with Vanessa at the North Dakota Long-Term Care Association. Again, we actually discussed this on our prep call on Monday, that the long-term care facilities in our state don't actually get the specific information on Delta variant. So if a resident tests positive, or staff member tests positive, they don't know if it was Delta variant or just original COVID. They are also running out of ideas for vaccination in long-term care facilities. I know one of our mentor facilities mentioned that they offered a $200 incentive, and there was only like one taker on that, which was interesting. Mandates have been discussed, but obviously knowing the challenges with staffing that y'all are facing, we know that that is not always a very popular idea for administration to have to face. And the North Dakota Long-Term Care Association, their education again continues to be Dr. Carson's videos, as well as some of your National Association offerings. Next slide.
So Sarah, I was just going to interject in there, is that one of the other discussions, and we can kind of throw this out for an open discussion about the varied reasons why people persistently have vaccine hesitancy. For those that, I mean, and part of this may just require a survey of unvaccinated staff to see what the distribution of reasons are so that they can be addressed one by one. There are top reasons, and one of the top reasons for not getting vaccinated is people wanted to wait. And what they're waiting for, I don't know. But that's kind of been one of the large attitudes, is that, yeah, we'll get the vaccine, but I just kind of wait until I get it. So that's sort of that procrastination. And of course, we're seeing multiple accounts now of people who procrastinated with the vaccine, and their final text message to their family was, I wish I had gotten the vaccine sooner. So I think there's an increasing and more compelling reason now with the Delta virus. So I think leadership in the facilities need to press the issue a little more strongly and urgently, that if they can identify staff members in their facility who are hesitant because they wanted to wait, that, all the evidence is that we're going back through another surge. And so the time is now, and you got to get the vaccine. So again, I think one of the things to do is to consider using a survey of your unvaccinated staff to get the prime reasons why they don't want to be vaccinated. One of the other things that continues to pop up is the concern about the side effects of the vaccine as it relates to fertility, which is 100% been disproven. And so, that point of view needs to be challenged as to what people are thinking, because there is no evidence. Furthermore, the loss of the pregnancy, premature termination of pregnancy, is induced by COVID. And so if you're vaccinated, you're protecting your fetus, from death. So that's why the American College of OB-Gynecologists recommend that all pregnant women get vaccinated, because the risk of preterm, delivery and fetal death is higher in unvaccinated who then get COVID compared to those that have been vaccinated. And in fact, there was also a study that came out that showed lower birth defects in the vaccinated women compared to unvaccinated women. So however you want to use the data, everything is really very compellingly in favor of the vaccine. We still have, I believe, the last I looked, there was 149 million people who are still unvaccinated compared to the 160 million who have been vaccinated in the US. And out of those, there have only been 28 serious side effects. So you got a better chance of winning the lottery than to get side effects from, serious side effects from the vaccine. It's really quite extraordinarily safe. Okay, go ahead, Sarah. You can move on to the next slide.
Next slide, please. I'm actually going to pass it off now to Kelly to discuss some of her pre-video questions to consider, and then we'll head into the IHI video. Kelly?
Thanks, Sarah. Hey, and do you have the questions on subsequent slides? Oh, wait, you can go back to the first one. I was just making sure I didn't need to read them off my list. Thank you. And just to tag on to Dr. Duravich's comment, I think it is very important to understand the why behind the hesitancy with vaccines, because people have multiple reasons for why they are not getting the vaccine. And if you could really provide them with the data and the information to allow them to make the best choice, then I think you're in a better situation. But if you don't know why, then you just saying you need to get the vaccine is not going to encourage them anymore if you don't have the information to support it. So as always, we're going to go over some questions to kind of get your wheels spinning whenever we get into this video. Go to the first one. First, how do you build trust with your staff? And you can take a look back pre-COVID, if anybody can remember that far back, pre-COVID, and kind of think about what you did to build trust with your staff then. How did they feel comfortable coming to you and talking to you? How did they take your direction and guidance in the past? And how can you repurpose that same skill set at this point? Because it's in order for your staff to be willing to follow your directions or your guidance, they have to trust you. And I know the ever-changing times these days, guidelines have changed. And so I feel like some of them may be getting mixed messages or may not be getting all of the message. So transparency is crucial during this time with your staff, and that should assist in building that trust with them. We kind of think about that as we go into the video. You can go to the next question. Now, everyone has some sort of social media platform, and how is it that you are able to combat that misinformation? I know we've heard a lot about that on the news here lately, misinformation regarding the COVID vaccine or just COVID in general. And you have to be prepared to answer those questions. And as leaders in your organization, have that bag of resources at your fingertips, so you can come back to them and say, well, this is the true data. This is what we have, and explain to them what the difference is between what they're hearing and what they're seeing on social media or the news or wherever they're watching it. And once again, if you have that trust with your staff, then you have that opportunity to have those conversations. And so you have to, your first step is really building your trust with your staff. The second step is being able to provide them with the resources and the information at appropriate times. Go one more. And last but not least, what communication style are you using when you're having these COVID-19 vaccine discussions with your staff? I think if you try to think back once again to pre-COVID, and as you're putting a new system in place, or you've completed a root cause analysis and you have some issues that need to be addressed and there's opportunities for improvement, you're talking to your staff then, and you're trying to get as much feedback and input from the staff as possible. And that's what you need to do in this situation too. It's really, the concepts and the steps are not different. It's just a different conversation. So kind of take a step back and think about how you were doing that before, and how you can then roll this over into a COVID-19 conversation. And now we'll go on to the video, and then whenever we wrap the video up, then please make sure you can provide some feedback. I see that Mary Lou, she posts a CDC link for specific answers and asks staff what have they heard and what's the source. That's a great way to address it. Mary Lou is asking them, where are you getting this information from? There may be something else out there. So I think that that is a great point to ask them where they're getting their information from, so you can better provide feedback to them. Awesome. And if everybody else has any comments, please chat them in.
Yeah, before you start the video, I was just going to mention, Kelly, the building trust, I think is part of it is what we've been trying to emphasize is the at least weekly structured walk rounds. And so by asking people, how are things going? Is there anything that you need that I can provide you? You know, is there anything missing? And just asking that question on a repetitive basis is that consistent, you know, conveyance that I care. You know, I want to make sure you have everything that all the tools that you have to get your job done. And sometimes these things pop up as quality improvement issues. You know, that there's something missing or something in the chain of command that'll pop up, and then you can actually, you know, put that on your little, you know, checklist, your 3x5 card, or however you with my geriatric fellow trainees, they have their they're using their phones, they're using their smartphones to do little messages now. So I don't know, that might be a good habit also. But again, yeah, that the consistency of doing structured walk rounds is really one way to enhance the communication and to build trust. The other trust building technique that we talked about, and again, some of this may sound redundant, but it needs to be emphasized over and over again, is the buddy system, and having, you know, staff, so peer-to-peer relationships, and you know, using that and monitoring that, seeing how that's going. That peer-to-peer relationship may also be mentors, you know, nurse to CNAs. There's a family friend who's a CNA here in Grand Forks, and you know, I just asked her about how, you know, what's her relationship with nurses, and she says, you know, and you could tell there was a lot of pride in her expression about the fact that the nurses trust her and trust her clinical judgment. So, you know, it gets back to this whole issue as to how do you recognize COVID infection in elderly patients or in immunocompromised or debilitated patients. And, you know, it's different, right? You know, the symptoms are different. They typically are gastrointestinal, loss of appetite. And so when you see that transition, when somebody pushes their tray away or says, I'm not hungry today, I mean, that's COVID until proven otherwise. And so just, you know, having a CNA recognize that right from the get-go, saying, I'm concerned about Mrs. Jones because she didn't eat today. I think we should do a, you know, a Bionex test or, you know, rapid antigen test on her. That's a real heads up. That's the kind of staff that you want to develop. And then the nurses really appreciate that, you know, feedback, you know, from that person. So that's trust building, that pairing up between peers and, you know, different staffing levels. So that interdisciplinary element is just so vital. So I just really wanted to emphasize that. And you know, you know, like I say, the question I asked of the CNA, you know, friend, you know, as to how are you doing with the nurses? Just maybe if you do that on your walk rounds, how are things going with the nurses? Are they listening to your, you know, evaluations? Is there anything that we can do to improve, you know, the line of communication and so forth? So those are all through structured walk rounds.
And I'll also add to that, Dr. J, when you talk about those structured walk rounds, most of you probably have a manager or somebody in leadership staff that cover one unit on their walk rounds or one hallway or whatever the case may be. And understand that your team members on your leadership team, they can build that trust relationship with those folks. And so as an administrator or a director of nursing or director of quality, whatever your role is, you are not the sole person responsible for building those relationships. And give everybody on their walk around checklist, hey, today we know who's vaccinated and who's not vaccinated, right? Ask them, are there questions you have specifically about the vaccine? Or can you tell me what it is that really is making you hesitant right now? Maybe I can help shine some light on some resources for you. You'll hear in this video too, is really approaching them and can we have this conversation? Is this okay? I mean, this has been a constant conversation for a long time. And if someone has dug their heels in completely, if you go up and ask them, they may not tell you anyway. So maybe it's better to have that, hey, can we talk about this right now? Or do you have a minute to discuss it? But I guess back to my original point is that everybody can have those conversations and build that trust. It doesn't have to be one single person in the facility and share that duties. And then in your stand-up meeting the next day, you can say, okay, Sally, out of the 5 unvaccinated staff on your unit that you round on, did they give you a response on why they were hesitant? And, oh, you know what? 4 of them are, pregnant, and that's the reason for their hesitancy. And somebody else says, oh, it's still in the emergency authorization. That's why they're nervous. And then track and trend that. And then you can determine, okay, this is our biggest group of hesitancy. So now what can we bring forth to those folks?
Yeah. And I'm sorry, Kelly, to interrupt, but as you were talking about the connectivity between leadership and a unit leader, as a geriatrics doctor, and former medical director, I always took a very proactive view. So what I would do, and this is maybe pie in the sky, but because not all medical directors think the same way I do, but my approach would be, show me you're unvaccinated, and I want to sit down with 3 of them for lunch. I'm going to bring in lunch, and we're gonna talk this out. No arms, no strong arming or anything, but just to really have a kind of a one-on-one or 3-on-1, whatever, and just kind of figure this out. And again, behavioral changes, just in terms of the process of changing behaviors. We have to do this in healthcare, right? So when I ask people, do they exercise in my clinic? And they say no. I said, well, what do you think you can do to do a little bit of walking, for example? And so it's a small change. What is that small change? And that's the same conversation with the vaccine. If you've got somebody that's hesitant about the vaccine, there's going to be a range of people. There's going to be people that are, the total refuseniks, but then everybody else, and that's a very small percentage. That's less than 5%. Everybody else is going to be amenable to change. It's just a matter of when, and through what. And so I guess what I'm getting at is that it would really, I think the medical directors are underutilized. And if you're paying your medical director either an hourly rate or a set monthly rate, I really think you should tap them for their for their assistance on this, and just say, I have a sit down with the medical director and just say, what do you think we can do to improve the vaccination rate? And what can you say, or what can you do? Maybe have a round table session, invite them for a round table as part of their medical directorship duties. So yeah, I would really defer to the medical director and see if that, and you know what, you can convert that into a PIP and see if it works, and see if you've moved the needle on the percent of vaccinated people. And if the medical director does not move the needle, you have my permission to spank him or her. So with that said, why don't we head into the video here?
Hi, I'm Dr. Leslie Ebert, and today we're going to talk about promoting the COVID-19 vaccine confidence, embracing the opportunity for impact. These slides were developed by myself, Tara Rouse, and Erin Vignier. So let's get started. COVID-19 vaccination education needs to be up-to-date, dynamic, and responsive. You can't just share the same old information time after time. That doesn't lead anybody to get a vaccine. And so it's really important to think about the conversations that we'll have with people. It is still all about trust. Trust-building interactions really over time are going to be a key ingredient on how to increase uptake about the COVID-19 vaccine. Staff still have concerns, and more than ever, they want to have a safe and accessible and approachable space to have a conversation. They want to be seen and heard and respected, and they want the conversation to be with empathy and not judgment or humiliation. A conversation is an opportunity. But we have a lot of barriers to trust, and certainly we have a whole lot more since the COVID-19 pandemic. Previous inconsistencies in the COVID-19 information has definitely deteriorated trust. An example is about masks and hydroxychloroquine. We have news and social media giving equal weight to different opinions, whether they're accurate or not. And that also diminishes confidence and trust about the COVID-19 vaccine. The lack of transparency during the pandemic, both locally and nationally, can also have an effect on trust. And the wrong message. One personal story on TikTok that looks very compelling, even if it's not accurate, may resonate with people more than the experience of millions. And then there's abstraction. If specific details and questions aren't answered, people will fill in the gaps with information found elsewhere. And this may be information that's inaccurate. And then there's also your facility culture. Having an open and transparent culture at the facility level does build trust. People want to know that you have their true interest at heart, and it's not just increasing the number of people who are vaccinated. And then there's apprehension after the Johnson & Johnson vaccine pause that also question the trust about all COVID-19 vaccines. In the end, principles that increase trust and acceptance about the COVID-19 vaccine are about people's values and identities. People are unlikely to do something unless it resonates with their own values. And finding common ground is a great strategy to move forward in the conversation. Maybe it's that we can both say we really are hopeful that the COVID-19 pandemic ends soon. We would all like to go into a coffee shop and have some coffee with our friends. And investing in that common ground can be really instrumental to moving the conversation. We also need psychological safety to have this conversation and creating a safe space. Framing the work is really helpful. The work we do is really important. We tend to people's lives emotionally, physically, socially, personally. With the COVID-19 pandemic, there's also a lot of uncertainty. So it's really important that we're transparent and able to build a relationship of trust. And then modeling fallibility, saying, I might miss something and I need your input. Inviting people to participate and letting you know that you value their input is really helpful to promote psychological safety. And then embracing the messenger and thanking people to have this conversation. So let's talk about the COVID-19 conversation. It's important to understand the why behind the person's vaccine hesitancy, and that's often where I start. And it's important not to put the person on the spot or make them feel defensive. Mostly I ask people, what are their concerns? And then it's about active listening, asking open-ended questions, and validating the person's lived experience without judgment. Remember, the purpose of this conversation is not to judge, assume, blame, shame, cajole, or pressure the person. This is not an effective way to have someone accept a COVID-19 vaccine or any vaccine. What is an effective way when having the COVID-19 vaccine discussion is to activate someone's agency. Agency is the ability of an individual or group to choose to act with purpose. It is empowering, and it needs both power and courage, the courage to act in the face of difficulty or uncertainty, and to understand each person has their own agency to make their own personal choice. And this is an avenue towards COVID-19 vaccination. Key factors to keep in mind as you begin your conversation is to start with empathy, provide accurate information. If you don't know the answer to a question, that's okay. Don't make it up. Say you will get back to the person with the answer and make sure that you follow through. Avoid underestimating what people can understand. People feel that when that's in a conversation, and it can be a conversation stopper. Building your message around their concerns and their agenda is really effective, providing details and opening with a question. We can also use motivational interviewing. This has been a decades-long strategy to help with vaccinations of all kinds. But what is motivational interviewing? It's a person-centered conversation to address the common problem of ambivalence about change. And it's strengthening the person's own motivation and commitment to change. And so how do we do it? There are a lot of strategies for motivational interviewing, and I'm going to share a few with you. This is a four-pronged approach on how you can do it. You can engage to build support in a relationship where there is trust and respect, then focusing on the ongoing process of choosing in the specific topic, evoking, bringing someone's strengths and knowledge and ideas about the situation to the table. We all have gifts that we can bring to the table, and empowering the person to see their own knowledge and choice and agency is a very powerful way to do motivational interviewing. And then planning, helping someone with their next steps. The spirit of motivational interviewing involves compassion, acceptance, partnership in a mutually respected conversation, and then evocation. Here's an example of motivational interviewing that I particularly like. It's the ask, tell, ask. So first we ask for permission to have the conversation. I bet you this is not the first conversation that this person may have had about the COVID-19 vaccine. And it's nice to present this ask of, let's see what you already know. And do you have any questions or concerns? Tell me your thoughts about this vaccine. And then the tell part. You said that something is on your mind right now. Let's talk about that further. Giving information in a neutral way. The purpose is to share information, not change the person's mind. And emphasizing choice and options really empowers that person. And then there's the second ask. I wonder how you think we might best proceed from here. Or using the teach back. I'd like to make sure I did a pretty good job in explaining this. Can you tell me now what you know about the COVID-19 vaccine? Sometimes the person's own voice can be very helpful in their decision-making process. Having realistic expectations for a COVID-19 vaccine conversation is crucial. The pandemic has really been stressful and anxiety producing and has caused a lot of apprehension. That's to be expected. And resistance to change is normal. People have feelings of fear and uncertainty. Avoid getting into a dueling match. I'm right, you're wrong. That's never effective. And instead invite the person to explore their own sources of resistance rather than confronting them. Understanding that different communities may have different relationships with vaccination is really imperative, and we'll talk more about that in just a few moments. It's not only what you say, but how you say it. It's important to humanize the person. It's not a script. Meeting people where they are and listening to them actively. And as Kimberly Manning says, don't just wag your finger. That's not effective nor pleasant. You don't have to seal the deal. We're not used car salesmen. And my most successful experiences with the COVID-19 vaccine conversations is when I did not seal the deal. I left the room not knowing what the person might do, but I knew they had all the information that they needed at that moment and that they could ask me more questions later. Take your time and show you care. Don't be afraid to be quiet. People respond to what they feel in an authentic conversation. Demonstrate that you care about them as a person. And then build the narrative around your own vaccine story. And this is something that I often do. The messenger matters, and it's not just DONs or the administrator or your medical director. CNAs, nurses, people from dietary may have really compelling stories about how they were nervous about the COVID-19 vaccine, but this is what made the difference for them. Sharing their stories and giving them a voice is really very helpful. Communities have different relationships with COVID-19 vaccines and all vaccines. Tuskegee was not just an isolated event. Rather, it was one component of structural racism in our country and in our medical community. Decades of mistrust and exploitation have led to true fear and profound lack of trust that we can understand. Validating that lived experience and respecting people's emotions is a beginning. And having this conversation and listening is a process that shows respect for everyone's lived experiences. It's also helpful to talk about how our drug trials have improved and are more inclusive now. And we try to include many different communities. People often want to know that people like them were included in the vaccine trials. Spread the word and make it fun. It's a joyous event to have a COVID-19 vaccine, and it presents an opportunity for hope. And so it's really important to make it as joyful as possible. You can have stickers and buttons and a bulletin board. I also often share my own vaccine story. I remember when I got my COVID-19 vaccine, I did it really for my family, my patients, and my coworkers. And I remember walking into my house on that afternoon, feeling at that moment, for the first time in a very long time, that I would no longer be a danger and a burden to my family. And so that's what motivated me. Here are some action items that you can talk about with your ECHO cohort and some discussion questions. Thank you very much.
Thanks, Sarah, for putting that on. Just a couple of follow-ups from the video that I wanted to mention and kind of get you guys thinking about. And, in the very beginning of the video, she said, if you're sharing information, make sure you're not just sharing the same things over and over again. And if you recall last week prior to our video that we shared, that was one of the questions is how do you get your most up-to-date information? Where do you get it from? How do you disseminate that information to folks? So just remember, if you're pushing the same information out over and over, that's starting to break that trust too. Like, you're just telling me the same thing again, Kelly. So make sure that you are still getting that up-to-date information and you are getting it out to folks. Number two, she made a comment about follow through. After you've had a discussion with someone, if you don't know the answer and you tell them you're going to go get the answer, it's imperative that you go back and provide them with that feedback. Once again, that breaks that trust cycle because you promised you were going to do something, you didn't do it. Motivational interviewing. I'd love to see in the chat how many of you use that technique whenever you're talking with your staff. And it's not necessarily just about COVID-19, just in general when you're having conversations. If you do, I would love to hear from you guys and see how it works for you, or if you have any tips and tricks that are successful. And while we're waiting on those chats to come in, we talk a lot about whenever you're doing any project, any system, making any change within your facility, if your staff feels empowered to participate in that, then they're going to be more successful in that project. And that's the same that goes with this, is if you're empowering them to make the best decision because they have all of the right tools now, then you may see an uptick in it. So it may be an opportunity, to get one group, one unit, one small area and say, you know what, let me make sure I do these one-on-one conversations with the staff, determine what their hesitancy is. Let me provide them the most up-to-date real information, and then see what kind of turnaround you get from that. If that works, move to your next unit, but really try to focus on some system to try to turn those over. Last but not least, we talked about, communities have different relationships with the vaccine, and, maybe reach out to your local health department. If you are a community that has a very low vaccine percentage, then reach out to your local health department and say, hey, what can we do as a community? At the end of the day, all the healthcare providers are doing the same thing, which is caring for those community members. So maybe you can work together with the community, the local health department, and put something on to help promote those vaccines as well. Just a couple follow-ups. I will turn it back over.
Yeah, great, Kelly. And you really hit the nail on the head with one of the points that comes out of the nursing literature about education. So, we talked about motivational interviewing, but also in terms of the techniques that are really good for what we call adult education. There's the youth education, and then there's the adult education. And the nursing literature supports exactly what Kelly was talking about, which is you do a one-on-one, and then you have a group, and then you go back to one-on-one, and that really helps reinforce the educational, the learning material, what people learn. Because if you do just one pass, it doesn't get absorbed, nor does it change the behavior. One of the other things that might be worthwhile mentioning is that, and you can use that motivational interview, by the way. You can just, cut it out of, you can do a screenshot. So these videos are posted on our website, and you can do a screenshot, or if you want, we can send you that slide deck. And you can use that motivational interviewing as a structured one-on-one interview with your staff. But what I was going to add to that is that there's another technique that we use clinically sometimes, not always, but which is effective, and it's called target practice. And what you do is you get a target, and you get the different topics that are related to the safety issue of COVID. So masks, PPE, visors, or shields, vaccine. And then you ask, the participant or your staff member to move those into the target as to what's the most important, which one's the bullseye for you, which one is second important, third. So you kind of order rank them, and then you use the target, the one that goes into the bullseye, as a point of discussion. And your point of discussion for target practice may be, we want to, I want your opinions on how to ramp up COVID safety, and here's our tools. I want you to order rank them as to their importance. And if they don't put vaccine in there, if they put masks as the first one and don't include vaccine, then that's a point of discussion, for that you can go from that. So again, it's a visual aid that can help structure the conversation through motivational interviewing. So that's called target practice.
Dr. Jurevich?
Yeah.
We have a couple of shares today, so
Okay.
maybe we can move away from some of the didactic and get the shares.
Absolutely. Let's head for that. Thank you, Sarah.
Michelle or Jean?
Well, I'll start the ball rolling here. This is Jean. So I'll kind of refresh everybody in terms of what we did last week. We talked about how to assess staff morale, and we suggested that if you had a recent staff survey, to use that data as your baseline. If you didn't, we provided some links for that. We also shared with you the IHI framework for improving work, and we emphasized steps 1 and 2 of the conversation guide in Appendix A. We ask you to meet with staff and have conversations around what matters to you and what impedes joy and work to you. And consider this your root cause analysis. And then we ask you to take this information and create a PIP. So naturally, Cindy from Wishick took this information and this strategy and she ran with it. And today she's going to share with you what she discovered in her nursing home.
I don't see Cindy. Did she have to jump off?
I don't either. Hopefully not. Can we go to the next slide? Maybe we can kind of.
Can you hear me?
Oh, yes, we can.
This is Michelle. I'm sorry, my computer's not working. I'm trying to use my phone and it made me go back to settings to get to my microphone. I don't have any more information from Cindy either to share. But what I did put together here was just some thoughts for the next steps in your PDSA. So once you've got the those first steps that we shared last week. We meet as a PIP, and then we review the conversation questions and prepare for that, and then go out and ask 5 or 10 people, what matters to you? What are those impediments? This is the next set of PDSA thoughts. Meet again as a PIP, and then prioritize those impediments that you identified during those conversations. And once you've identified, what looks to be the number one impediments there, then we can look at some of these interventions that were provided by IHI in both the change ideas in that Appendix B from the white paper we sent out last week, or we also have another white paper that is specific to COVID and these same kind of conversations that has just a list of interventions or change ideas. And take a look at one of those, and see what might be something we could trial. And then let's just start with that. Start small with one change idea to trial, and plan, do, study, act to see if that, if we're making any difference, making any headway with using any of those interventions. Since I've got the microphone too, I just want to add that GP Quinn is actually hosting a webinar on the 17th, all about motivational interviewing and the vaccination process. So if you just go to our greatplainsquinn.org website, you can sign up for that. And then we could probably, unless Cindy has joined us. Okay, well, maybe we can go to the next couple of slides where we just have some questions to ask. We'd love to have you unmute or chat in what staff morale activities you have done recently. Anything that you've been just recently trialing with all of the challenges that we're dealing with. And I'm sorry, I can't see the chat.
I got it for you, Michelle.
Okay.
Yeah, and I just put in the chat too, if any of you have been able to do that survey. I know Cindy, when we talked to her on Monday, she was waiting on, I think it was 20 surveys to come back, because she was testing just a small group to try to really get an idea of where to start her performance improvement plan and where to focus her attention. So I'm just curious if anybody else had that opportunity after our meeting last week to do that. Oh, Amanda did a survey and submitted the data. So you uploaded yours, Amanda. If you want to come off mute and tell us if you what kind of ideas you got from your survey, or you can put it in the chat. Either way. Dr. J also mentioned, I mentioned on our call on Monday, when you talk about getting the community involved, if you could get a vaccine van that goes from facility to facility with a food truck behind it, maybe you could turn some folks over that way too. April, I saw that you were on earlier. Did you guys, have y'all been able to focus on that, or are you still focusing on your falls?
Oh, the notorious state survey, yeah.
Yeah. Well, that makes sense. I hope you guys did well. Oh, Amanda just responded that they put their surveys out on the front sign-in area for staff to do and keep anonymous. And a lot of them were taken, but they've only gotten 7 back so far. Oh, good, good. Can you give us an example of some of the comments that you may have gotten, what can be improved upon? And once again, this goes back to really empowering your staff to participate in these conversations. If they're coming to you and saying, hey, I think these are areas that we can improve upon, and then you put something in place to address those concerns, then you're going to get more buy-in from the staff. And as long as the staff is willing to not be anonymous, you could even use that. You know what? Sally, who works on Wing A, made this great recommendation. And then that really pumps Sally up. And then it's going to make other people realize, you know what? People are listening to me. They're doing something with it. I'm going to come forward too, and I'm going to participate, not just COVID related, throughout the facility on different projects you're working on.
Yeah, I'd add, Kelly, that the other technique is to write a little card and put it in U.S. Postal Service and mail it to the staff's home address, thanking them for their input. that really generates a lot of goodwill and builds on that trust too.
Okay. And Norma responded too that they put surveys out last week too. So I'm glad you guys are following up on this, and I hope you come up with some great ideas to focus your attention on. Communication and teamwork is something that Amanda said that came up. And, you know, we talked about communication. I think it was actually on one of our fall pips. We really tried to focus in on communication and how the improvement in communication can really bring those fall rates down, which can affect everything in your facility.
Yeah, and I think what we're learning from our group here, from Amanda and Norma, for example, that doing structured formal surveys is a really good means for starting the conversation. Again, so that's a supplement to the structured walk rounds, but again, it's another tool that's really very valuable.
Yeah, and once you get an area that you need to improve on, so say Amanda tracks and trends these surveys and says, you know what, communication is the number one thing or response I'm getting. Now you do your root cause analysis. Now you determine why is communication such an issue. And I know I've mentioned in the past is that don't automatically go to, hey, let's just go train all the staff on communication, because that it may not be a training issue. It may be a time issue. It may be that they don't have the right tools to communicate certain things between one another. So you have to do that root cause analysis to really determine what interventions to put in place.
Yeah, and I would add to that again, you know, the what Amanda's talking about with all the departments, and so having those, you know, one-on-one and then group and then one-on-one follow-up educational meetings with housekeeping, for example, you know, ask their opinion. You know, are there things that we can do to improve infection control in here? You know, are people observing, you know, proper protocol and hand washing and so forth? Get their input and see if they have any observations. And if not, it'll certainly create them to think about observing in the future. Like, are people doing hand hygiene? And all of a sudden they'll start looking at it, and then you can ask them to even do a little 3x5 card checklist to report back. So it could be like an internal audit that you can assign housekeeping to do for, you know, like I say, hand hygiene.
Yeah, and this survey practice alone you may actually see an improvement in your employee morale, because you're reaching out to them, you're asking for their input, you're asking for their feedback, and going back to that video again, make sure you follow through on whatever it is that you come up with. And if you make sure you pull some of those line staff to participate on that PIP team, once you come up with this is, you know, what your focus area is going to be, they participate in the root cause analysis process. They participate in developing those interventions or choosing which interventions are appropriate. And then test whatever interventions you're going to do on the unit those folks work on, because they have buy-in at that point. And then once other staff see it successful, then they'll move forward. But if it's not successful, remember your PDSA cycle, adapt it